Oh, that was a tough act to follow, right?
You got it.
Thanks. Okay, so I used to take my clothes off for money. Some of y'all are shocked, especially my coworkers that are in the back. Love y'all. Thanks for coming. I actually just came from presenting at a Durham County Board of Health meeting where I work a super boring professional job working for the government. Yeah. But before all that, I used to take my clothes off for money. And it was a shock to me too, actually. I had been a chubby, pimply-faced teenager whose already graduated friend took her to senior prom as a pity date. I outgrew all that, clearly. But when I was young, I spent, like way too many other young women I know, a lot of time looking at my body with disgust and avoiding at all costs ever seeing myself naked. So what better way for me to face all my body image fears than to take a job where I would be naked, from the waist down, under a bright fluorescent light, and second-year med students would practice performing pelvic exams on my vagina. So it was basically sex ed for adults, okay? Don't worry, I was paid really well, y'all. It's amazing the fears you can get me to confront for the right price, I'm not gonna lie. I would go back and do that job in a minute. So here's how it all went down. Two of us instructors would lead the class for about 5 med students at a time. We always started with a sexual history role-playing exercise, and the students were given a list of things that they had to figure out about their patient, and it was up to them to figure out exactly what questions to ask. So this was the fun part for me. I got to play the role of the patient. Some of the students like to start their sexual history with the question, are you married? So if you don't already know this, and all of y'all know this, I'm sure, married women have multiple sex partners. Not as a rule, y'all, okay, but more often than you would think. Even the bless your heart soccer mom who's super saved and wearing the gold cross necklace, she's probably having all the kinky sex. So more savvy students would open their sexual history with the recommended question, which is, are you sexually active? In the role of the patient, I would always respond, yes. Are you currently trying to get pregnant? No. What form of contraception are you using? Well, nothing, actually. And then I would watch their eyes light up because they were so ready to exercise all their skills and knowledge and educate me about the range of birth control options that I should be using to avoid an unplanned pregnancy. And this interaction has actually happened between me and healthcare providers in the past. And as with the students, I usually let them get about halfway through their spiel before I stop them and I say, so I didn't go to med school, and I'm not a doctor, but I'm pretty sure that 2 women having sex has never resulted in a pregnancy. So after debriefing the sexual history role play, we moved to the pelvic exam practice portion of the class. And this is where shit got real, because from this point onward, a group of shiny-faced, overachieving 20-somethings were going to examine my genitalia, and then they were going to look inside my vagina at my cervix. When I first started teaching, I remember thinking, okay, so the female students got this, right? Like, this is gonna be a slam dunk for them. They've been through this exam, they know it. And I mean, like, we all pay super close attention to our pelvic exams, right? Obviously. And I figured we've all, like, gotten a mirror and, like, looked at ourselves down there, even if it was just the one time after seeing the vagina monologue. So, like, you know, like, there's a level of comfort there, right? I was so worried about the guys, though. You know, this is going to be so weird for them. Like, I was going to have to do a lot of hand-holding. I was worried they were going to be intimidated. Okay. So the first night I taught the class, I could see that the students were all super nervous, like even more nervous than I was. And I got in the habit of opening each student's role play as the patient with, oh my gosh, you look super young to be a doctor. Are you the doctor? Like, is this your first pelvic exam? Because I want another doctor. trick of releasing some of that tension. So that night, the male students all volunteered to go first, shopping. And they were fine, actually, more than fine. They breezed through everything. Like, they knew exactly what they were doing, and they were completely comfortable doing it. There was one student, I remember, as he was inserting the speculum, rested his other arm on my thigh. I was like, whoa there, Doc. So I'm not a couch, and as a general rule, you should probably avoid reclining on your patient. When it was time to see my cervix, the male students, they were there, you know, like face an inch or two from my body, ready to dive in. They got it, you know? So the female students went last that night, and they were a completely different story. They were terrified. I had to coax them in, remind them that they had to look at and touch their patient during this exam. You know, you can't actually see my cervix from 2 feet away. Didn't know if you knew that, but you can't. There was one female student that I will never forget. She went last in her group that night. Her voice trembled as she explained the exam to me as the patient, an exercise that we had all the students do. And as she rolled up the drape, revealing my naked body, a look came over her face of disgust. Like she had just opened a 1-month-old container of leftovers. Now I know for a fact, and others can attest to this, that I have a perfectly normal, healthy vagina. But that shook me up a little bit, you know? And I remember thinking like, wait, were you expecting a porn vagina, like all pink and bald? Because that is not what I'm rocking right now. She was able to breeze through the external portion of the exam without actually touching me, so my co-instructor and I had to redo it. And she inserted the speculum, and when it was time to see my cervix, I saw it again. That look, it was like, oh my God, ooh, gross. And she walked out right in the middle of her practice. She couldn't finish. So I really honestly don't know why she reacted that way. It could have been some trauma from her past, right? It could have just been nerves. Med school is like a super highly charged, competitive environment. What I do know, though, is that her reaction, although extreme, was not that unique. I saw that reaction from other female students, too. And I was like, but why? Like, how did I get this so wrong? What made the men so comfortable and the women so afraid? So a couple of my hetero guy friends educated me on this over some beers, and they were like, Natalie, of course the guys ace this. Like, they've been down there. They know their way around, you know? Like, this is totally familiar territory for them. And that was my aha moment, right? It's familiar. There's this saying that familiarity breeds contempt. But according to my college social psych professor, and he'll be very proud that I remember this, familiarity breeds liking. So the more familiar we are with someone, the more we tend to like them. And that got me thinking, like, I wonder if that's true for vaginas, you know? We currently live in a culture that constantly tells women that there's something wrong with our bodies. The fat on our bellies and our thighs, the ripples of stretch marks, the cellulite dimples, the hair that grows under our arms, on our legs, on our mons pubis, and our labia. Hell, even our labia can be too big or asymmetrical. I've heard that labiaplasty is one of the fastest growing cosmetic surgeries in America. So, I'm a white, petite, able-bodied, cisgender woman, and I know that my struggle is not as real as so many other women that get told in much louder voices that their bodies are wrong. And at the same time, for many of us, hating our bodies is as much part of our routine as brushing our teeth. So if I had spent a lot of my life looking at my body with disgust, it only made sense that other young women would too. I was a reflection of them. And I was forcing them to confront the part of themselves that was the least familiar. So at the end of every class, we had students fill out a detailed evaluation, because we were public health professionals. And I really looked forward to this part after the hand-holding and the hesitancy and the occasional looks of disgust, because I read all these comments of praise and gratitude. Comments like, thank you, that was the best class I had in med school, or you're so brave. And all the times I taught, I never read a negative comment. And I'd like to think that confronting my vagina started something for those women. The process of maybe building intimacy with their own bodies. The parts of themselves that were taught to hate. The flesh, the hair, the moisture, the smell. Like maybe they would go home and get a mirror and take a nice long look at themselves, you know? If only just to compare theirs with mine, right? And like if my vagina was the first non-porn vagina they'd ever seen, then I guess I was their gold standard. The vagina against which all other vaginas will now be measured. Which is awesome. I still cling to that. So if they did go home and get familiar with their own bodies, maybe that familiarity could breed liking. And maybe that self-love would breed love for their patients, and they could be better doctors and partners and women as a result. Who knows? As for me, I looked at my vagina long and hard before and during every class that I taught. I'm real familiar with that part of my body. So maybe that's why my vagina was the first part of myself that I really started to like, to feel confident about. Other parts of me have followed. Years ago, I bought a full-length mirror, put it in my bathroom so I could look at myself every time I step out the shower, see myself naked. The more I looked, the more familiar I got. So yeah, I used to take my clothes off for money. But you know what's even more surprising, y'all? I'm at a point now where I take them off for free. Every chance I get. And when I look in the mirror, I like what I see.